Hi everyone, welcome to Med News, an extension of the Tutor Med channel, where we discuss issues of public health importance. And here on Med News, we redefine medical education. Now, did you know the whole of this week is World Glaucoma Week? Well, in case you didn't know, happy World Glaucoma Week. And we want to use this celebration to create awareness on glaucoma, because it is a very common cause of blindness. Kindly support us by liking and sharing this video and then subscribing to our channel. Let's get started. Glaucoma is a group of eye disorders characterized by progressive damage to the optic nerve. The optic nerve is located at the back of the eyeball and it sends visual information to the brain for interpretation. So you are able to see the images on your screen because your optic nerve is basically working. Now, this progressive damage to the optic nerve in glaucoma is often, but not always, associated with raised intraocular pressure. The intraocular pressure is basically the amount of pressure within the eyeball. And in glaucoma, oftentimes the pressure is raised, but not always. Glaucoma has affected about 64 million people globally, but unfortunately, only half of these patients are aware they have glaucoma. And so there is a need to create awareness because, as mentioned earlier, glaucoma is a very common cause of irreversible blindness. Now let's spend a few seconds understanding the structure of our eyeball. When you look into someone's eye, you see a white part of the eyeball called the sclera. And for most individuals, a brown part called the iris, but a few individuals may have different colors, like blue, green, but in this picture, blue. And so this is the iris. And then within the iris is a small hole through which light passes. That hole is called a pupil. Now, covering the iris is a clear or transparent structure called the cornea. Now, if I take the eyeball out of its socket, this is what we would see. There are some muscles on the eyeball but have been removed for simplicity's sake. And so, this is the sclera, the white part, and then the brownish circle here is the iris. And you see the pupil, which is a small hole in the center of the iris, and this is the transparent cornea covering the iris. Good. And so how does glaucoma occur? To get a basic understanding of glaucoma, let's look at the internal structure of the eyeball. And so we have the sclera, which is the outermost coat of the eyeball. And then the iris, which is the pigmented part, like we saw earlier, that it is mostly brown in most individuals. And behind the iris is this structure called the lens. Now remember, in the center of the iris is the small hole called the pupil. And light from objects we look at pass through the pupil and then through the lens to reach the internal layer of the eyeball called the retina, which sends information to the optic nerve here, located at the back of the eyeball. And this nerve sends information to the brain for interpretation. Then this is the cornea, the transparent structure which covers the iris. Now, when you study the internal structure of the eyeball very well, you would realize the eye has three chambers. Chamber number 1 is the anterior chamber, and it is the space between the cornea and the iris. Chamber number 2 is the posterior chamber, the space between the iris and the lens. Although this drawing or diagram does not really show that clearly, there is a space between the iris and the lens, and that is the posterior chamber. Then the vitreous chamber, the space behind the lens, and this chamber contains a substance known as the vitreous humor or body. Very good. Now within the eyeball is a structure known as the ciliary body, which produces a fluid called aqueous humor. The aqueous humor flows into chamber 2 and then through the pupil to chamber 1 or the anterior chamber. Now when it gets to the anterior chamber, there is a spongy network known as a trabecular network here in this angle, which drains the fluid out of the eye so that the pressure within the eye can be kept within normal limits or normal ranges. And for the normal situation, the rate at which the ciliary body produces the aqueous humor is the same as the rate at which the meshwork or the network drains the aqueous humor out of the eye. But in glaucoma, this drainage has a problem, and so the aqueous humor is not drained out. Therefore, it accumulates in the eye, raising the pressure within the eyeball. Now, this pressure build-up occurs in all 3 chambers, and it compresses the optic nerve at the back, leading to damage, which results in visual loss or blindness. And although not so detailed, this is what glaucoma is basically about, although there are other detailed pathophysiologies. Now, there are basically 2 types of glaucoma. We have the angle closure glaucoma, which is also known as the closed angle glaucoma. And then we have the open angle glaucoma. Between these 2, the most serious is the angle closure or closed angle glaucoma. And then the most common by far is the open angle glaucoma. Now the difference really is in their names. In closed angle glaucoma or angle closure glaucoma, the angle in the anterior chamber has been narrowed, and because it has been narrowed, fluid is not able to get to the meshwork to be drained, and that causes the glaucoma. Whilst in open angle glaucoma, the angle is open, but the meshwork itself probably has a problem, and so although the angle is open, the fluid is not able to get out of the eye. And so let's make this clear with this diagram. So the first picture shows the open type, and here the fluid is not going out because there is something probably blocking the spongy or trabecular network or meshwork. Then in the second picture, we have the closed angle type, and here the problem is that the lens for some reason pushes the iris to block the angle in the anterior chamber, and so hiding the drainage system from the aqueous humor. And because that path has been blocked, then we have a raised intracranial pressure or a buildup of the aqueous humor. And so what are the symptoms and signs of glaucoma? For the open angle glaucoma, the damage to the optic nerve occurs over a long period, and so is usually chronic. And as a result, the early stages usually come with no symptoms. The visual loss usually begins in the peripheral visual field and might not be apparent to the patient. It will be apparent to the patient when the optic nerve damage becomes very significant. Unfortunately, this type, as mentioned earlier, is the most common type, and so it is important to go for screening once every 1 to 2 years, because this type of glaucoma in the early stages does not come with symptoms. Then we have the closed angle type. Now, for these type of patients, there will be an acute onset of severe eye pain and eye redness, a decreased vision or total loss of vision, accompanied by headache, I should have said, nausea, and then vomiting. And so what is the way forward? the way forward is that please go for regular eye checkup or screening once every year or every 2 years, especially if you are above the age of 40 or above the age of 60 and you have hypertension, diabetes, or even a family history. Someone in your family has been diagnosed with glaucoma before. You need regular eye checkup. Now at the eye clinic, your ophthalmologist or eye doctor might perform tests like visual field exam to examine your visual field. He or she may perform fundoscopy, where he uses an instrument called the ophthalmoscope to look at your optic nerve, the integrity of your optic nerve. Then he or she may do something we call tonometry, and then tonometry is used to measure your intraocular pressure. Remember, most of the times or oftentimes, glaucoma is associated with raised intraocular pressure. And then the normal range should be somewhere between 6 to 21 millimeters of mercury. Again, he or she may do an exam known as gonioscopy, where he would visualize your anterior chamber, look at the angles to see whether they are closed or there's a pathology associated with it. Remember, there are drugs which can be given to reduce your intraocular pressure in the event that it is raised. Surgical procedures may be helpful, especially for patients with a closed angle type. Glaucoma causes irreversible blindness, but when detected early, the outcome is very good because interventions can be put in place to prevent blindness. But once glaucoma causes optic nerve damage, the optic nerve is gone. It is really irreversible. And so it is important that we go for eye screening regularly so that in the event that we have a raised intracranial pressure, something can be done about it. And so, thank you for watching. I am Dr. Kofi, a regular host. Kindly support us by sharing and liking our video and then subscribing to our channel. Bye.